Hello everyone. We have assembled here today on the occasion of the World Heart Day. This is a very important annual event and it started in the year 1999 when World Heart Federation designated 29th of September to be designated as World Heart Day every year. So why is it important to commemorate this particular day? The idea is to increase the global awareness about heart disease because up to 1.7 crore population all over the world die because of cardiovascular disease. And that is the reason it's important to understand the risk factors. And this year's theme for World Heart Day is Use Heart, No Heart. This is probably an indication or a signal to the general population to take care of everybody's heart. And to talk about World Heart Day and the preventive measures, we have an excellent panel today with us, who are the senior cardiologists of AMRI Hospital, Thakuria. We start with Dr. Soumya Kanti Dutta. He is a consultant cardiologist. We also have the legendary cardiologist, Dr. P.K. Hazra, who is a very well-known figure, not only across the cardiologists, but across all the physicians and the general population. We have Dr. Sumanta Chatterjee, another senior consultant cardiologist, and to talk about certain surgical aspects of the heart, because sometimes when medical interventions have probably not worked, then we need a cardiac surgeon to come to the rescue. So we will start with Dr. Soumya Kanti Dutta. Would you be able to tell us about the common risk factors of heart disease?
Definitely. So, if we categorize the risk factors, some are modifiable, some are not modifiable. So, not modifiable risk factors, obviously we know the genetic factors, the hereditary, that we can't modify. But being a cardiologist, what I can say that what we can prevent should focus on us. So, as you already said, the diabetes, hypertension, I call it a deadly duo, along with the kidney diseases, dyslipidemia or the lipid abnormalities like low HDL, high LDL, we all know in this category. And the most important thing in this post-COVID era, the recurrent infections. So these are the most common cause, and along with the dietary factors, unhealthy lifestyles, unhealthy food habits, lack of sleep, overstress, associated with addictions. These modifiable things are the most important factors in the cardiac disease, specifically in young Indians. And as we are seeing, most of the Indians hovering around 25 to 35 are having heart attack and new onset diabetes. So we can prevent not only the diabetes, not only the early onset hypertension, but as well as the heart disease too. It is preventable.
Thank you, Dr. Dutta. So this sends a very big warning signal to our population, and it is high time. If we've not been careful so far, we need to be careful right now. So I come to Dr. Hazra. So what do you think, how important is hypertension as a risk factor for cardiovascular disease?
Namaskar, good evening. Today, hypertension is one of the silent killer, I would say, of humanity, and large number of people in India and abroad are dying due to hypertension and its consequences. So hypertension, when it comes at young age, it affects many organs in our body. Stress, salt, non-adherence to drug or medicines may be one of the factors which can lead to death. So awareness is important, detection is important, lifestyle modifications, some gadgets can help you, but you should come to the clinic of a physician. They should check the blood pressure, and if it is detected, better to take medicine throughout your life rather than ignoring. And it's a myth that once the blood pressure medicine is taken, that can kill your kidney. It is no. So once it is taken, basically doctors give this medicine for lifelong prevention of heart disease and its consequences. So hypertension is very important along with other risk factors.
So that is a very important message from a very senior cardiologist, because a lot of times we see people in the clinic that they say that my blood pressure is absolutely fine when I monitor it at home. But when I come to the hospital, that is the time my blood pressure is high. So is it okay if I wait for some time and do not start the medicines? So Dr. Hazra, I come back to you again. that what would be a warning blood pressure if somebody measures a blood pressure at home? What kind of reading should alert?
Okay, so any blood pressure which gives symptom is hypertension. So if it is 140 by 90 or 135 by 90, so any figure can be a hypertensive figure. It gives symptoms like headache, neck pain, etc. But most of the time, hypertension is asymptomatic. So any number which is above 130 on the systolic or upper range, anything more than 90 on the lower range, for all practical purpose, you are hypertensive. Now there are ranges like 85 to 90, lower one, or 80 to 90. There may be a confusion. But once you have this kind of abnormal reading, like 85 or 135, then you should come for more frequent visits to your physicians, so that it can be detected for the high risk or organ damage or the initiation of medical therapy. It's not that all hypertension, mild hypertension, need to be treated by medical therapy. Lifestyle modifications, soil, fruits and vegetables, stress, sleeping well, and exercise, reducing body weight can delay the initiation of blood pressure medicines. But once the physician decides to initiate or continue, it should be controlled. So if you really want to know one figure, which is absolutely a good number, that will be 120 by 80. So anything above that, it is hypertension or pre-hypertension.
So I think that is a great message to everybody. So please do not ignore your blood pressure. If you are checking the blood pressure at home for yourself or your family members, and you have a recording which is consistently more than 120 and the lower blood pressure is more than 80. So probably do not decide on yourself. It's important where you can come to visit your cardiologist or your physician, and they will be probably able to advise you certain lifestyle modifications and, if necessary, medications in order to control this deadly risk factor for cardiovascular disease. We come to Dr. Sumanta Chatterjee. As we all know that diabetes is the other major problem. So I would like to ask you, how important in your practice, how frequently do you see diabetes, and what would you advise the general population?
So, diabetes is a very much important risk factor for cardiovascular disease, as we know that 1.7 crore people die from cardiovascular disease. And diabetes, hypertension and other risk factors are mainly the major risk factors. And diabetes and hypertension is deadly too. Diabetes and smoker is deadly too. So diabetes is not only an endocrine disorder. Now, for the last 5 to 10 years, we gradually are seeing that most of the mortality from diabetes is due to cardiovascular disease, from stroke and heart attack. And morbidities are also due to that thing. So, I mean, mere reduction of HbA1c or mere reduction of blood sugar, maybe fasting and PPS is not, this is necessary, but it is not, should not be the only goal. So our diabetes medications, that medications we should use, which medications we should use, that is paramount importance, because we have some tools, we have some medications for the last couple of years or maybe more than 5 years that have cardiac safe potential, or they have the capacity to reduce your cardiac morbidity and mortality. Whenever somebody is having diabetes or diagnosed to be having diabetes, so that those patients or those population should be subjected to those medicines which have the capacity to reduce your sugar and has the capacity to reduce your diabetic related mortality and morbidity. In this perspective, we should know our numbers. Fasting blood sugar and HbA1c, these two numbers are extremely important. Anybody crossing 40 years of age should look forward to that thing. Fasting blood sugar more than 126 and HbA1c more than 6.5. These are known as diabetic range. Diabetes, there the patient stamped as diabetes. But whenever your fasting blood sugar more than 100 or HbA1c more than 6, it should be extremely alerted. Lifestyle modifications and dietary regime, diabetic diet, this should be inculcated into your lifestyle. And if you stamped as diabetes, then medicines are started. So these are important. Nowadays, we have some medicines. Cardiologists are very much focused about diabetes recently. Why? Because diabetes is not only an endocrine disorder, it is a metabolic disorder, it is a cardiovascular disorder. So we should be very much focused on this perspective.
So thank you very much. I think this is a very, very important signal to all of us, because a lot of times we are in a comfort zone. Maybe some family member has been taking some oral hypoglycemic agent for about 15 years. So why change the medication? It's important because science has advanced quite a bit, and now we have certain drugs like Dr. Chatterjee mentioned, which are protective for the heart. So it not only controls your blood sugar, but it also goes a long way to prevent heart disease and diabetes related complications. So that is why it becomes increasingly important to identify. But to identify, you need to understand, especially if you have a family history of diabetes, it's important beyond the age of 40 to get your blood sugars checked, because only once you check the blood sugar would you be able to identify. And then definitely consult your cardiologist for more advice. We come to Dr. Mukherjee now. So a lot of times we are very concerned. The general population says, whatever is possible, please do it with medications. But sometimes, despite modification of a lot of risk factors, unfortunately, the patient may develop a heart attack. And once they have been seen by the cardiologist, the kind of the heart attack or the revascularization or the improvement of the cardiac condition may not be possible with medications alone. So what would be your idea as to which are these particular patients who definitely should not, just continue to stick to medical management? If they are referred by the cardiologist to you, which would be this kind of a population?
Definitely, we get a very high risk populations. Generally, that medications that are already given by cardiologists and patient symptoms are not decreasing with that medications, that definitely requires some form of revascularization. The revascularization may be angioplasty, maybe coronary artery bypass surgery, and both form of revascularization in some patients are very helpful. The patients are different. For the angioplasty, the patients are different. For the bypass surgery, the patients are different. But any form of revascularization ultimately gives some relief to these symptoms and obviously decreases the risk of heart attack in the future period. And in some cases, like bypass surgery gives a long-lasting effect, and sometimes the patient doesn't have heart problems or doesn't develop decreasing heart function, doesn't develop a heart attack for the rest of his life. So it is very important to ascertain which patient will definitely get benefit by these type of procedures. And we generally, as a cardiologist and cardiac surgeon, we generally have a team approach and we discuss which patient will be benefited by which method.
Thank you, Dr. Mukherjee. And with the advancement of surgical techniques, do you think that the morbidity following these kind of surgeries is much less in today's day?
Again, the advancement of the cardiac surgery and the anesthetic technique and the ICU, post-operative ICU care, definitely our surgery or coronary bypass surgery, the risk definitely decreases with time. And we are having now the minimally invasive surgery also. That also decreases the hospital time and increases the quality of life. And definitely patient goes back to life in very early period. Within 15 days or 10 days, they can go back to their normal life. So it is not because of patient cannot go for bypass surgery because of comorbidities. Because of comorbidities, they are suffering. And that comorbidities doesn't hinder the bypass surgery also. In fact, they will help the patient, bypass surgery will help the patient to go back to the normal life despite the comorbidities.
So that gives us a lot of reassurance that nowadays with advancement and minimally invasive surgeries, the patients can get back a good quality of life, that too in a very short duration. So we will wrap up by certain small comments regarding the other risk factors. So Dr. Dutta, I come to you regarding what do you think about smoking cessation and alcohol in the prevention of cardiovascular disease?
Smoking cessation in the cardiac context is absolutely important, because it is the most important addiction that leads to young Indians to the myocardial infarction. So the first thing in my letterhead what I write is no smoking. That means 1 or 2 cigarettes per day, I will reduce, I will postpone. So this is not the answer. You should stop that day and you should not start again. That is the most important message for smoking. Not only smoking, for every tobacco related things. That may be tobacco chewing, that may be nasi, that may be anything related to tobacco. Now coming to alcohol, mild to moderate intake is beneficial, there that is written, but it should not be binge drinking. So you should restrict or curtail your alcohol intake. Once you are chronic alcoholic, you should restrict, but smoking is absolutely no for cardiac disease.
So that is a very big warning signal. So absolutely no to smoking. We all know that cholesterol is bad for the heart. So how bad is cholesterol for the heart, and what should we be doing in order to modify our cholesterol levels? My question to Dr. Hazra, please.
Yeah, the heart blockage, it happens due to cholesterol deposits, nothing else. Now there are different types of cholesterol, but most important is your number of LDL cholesterol and Indian triglycerides. So other form of cholesterol can be reduced by the same mechanism, same medicine. So cholesterol lowering drugs should be started if you are having high risk patients, those who have undergone angioplasty or bypass surgery, or a familial history of hypercholesterolemia. Along with your diet, reducing trans fat, fried food, you should start taking some medicine. These are called statins. Some injectable forms are also available like vaccines. So cholesterol lowering, especially in patients who are suffering from diabetes, who had stent or heart attack or bypass surgery done, and have a family history of heart disease, sudden cardiac death, their cholesterol should be as low as possible by means of lifestyle modification, no smoking, along with some medications.
So can you put a number in order for our population to be aware?
Okay,
What should
so
we
if I give you a number of LDL cholesterol, any number which is 50% lower than the previous number is good. That is number one commandment. Second commandment will be if you're having heart disease or bypass surgery or stroke, your LDL should be as low as 30. 30 means it is too low for some people, but there are a lot of evidences that bringing it to 30 milligram or even lower than that can actually regress or can heal or can bypass the bypass surgery, bypass the stent surgery, bypass the heart attack, bypass the stroke. So there are many advantages. Those unfortunate people, they do not want a second event. So second event or third event, a progressive heart disease can be prevented if you keep your cholesterol number to less than 30.
So that is excellent. In fact, if you see the cholesterol number on your blood report, which is beyond the normal range, please seek the opinion of your physician or a cardiologist and let him or her decide what would be the best cholesterol for you, because he or she will assess your kind of risk factor and your kind of cholesterol target in order to make a difference. Now we end by an important thing, which is again very difficult to answer. How important do you think is stress related to cardiovascular disease, and what would you advise our population, especially in today's age where everybody is running, trying to meet our targets?
Stress is very much important risk factor nowadays. Occupational stress, societal stress, marital stress. So everywhere now we are facing stress in this rat race. So stress is not directly related to your cardiovascular disease, but they are related to risk factors. Stress means hypertension. Stress means diabetes. Stress means metabolic syndrome, obesity, sedentary lifestyle. These all risk factors. We know that diabetes, hypertension, thyroid, metabolic disease, sedentary lifestyle, obstructive sleep apnea, obesity, metabolic syndrome. These are all related to stress. Stress is one important factor. So de-stressing, stress buster kind of thing are very much important nowadays. So there is no calculation or statistics that this much stress is going to happen. Increase your diabetes, predisposition kind of thing. This is not the case, but we see that stress is related to every risk factors. And stress buster like sleep. Sleep is the most important and most strongest stress buster we know. Yoga, pranayam, gym, swimming. So everybody is having their different kind of stress buster kind of thing. Even singing. So these are very much important, and this important message to be inculcated in society from teenage. So we are going to have some this kind of rat race from our whole life. So from teenage, this important message is to be inculcated in our mind that stress is an important thing. It is related to risk factors and stress buster, some form of stress buster you should practice from your younger age. Maybe it's a kind of yoga, pranayama, maybe some sort of exercise, maybe just 15 minutes, 10 minutes or 30 minutes of stress buster practice from your teenage can be associated with reduction of developmental risk factors, or maybe some 5 years or 10 years postponement of this developmental risk factors. Thank you.
That is a great message. So qualifying for an entrance examination, getting our dream job, marrying the person whom you want, becoming the CEO of your particular company, we have ambitions. But it is also important for us to be able to alleviate our risk factors in order to achieve our goals, but at the same time maintain our sanity. So we end by asking Dr. Kaushik Mukherjee the importance of exercise. To some extent, Dr. Chatterjee has alluded to it. So what would be your recommendation to our population regarding the kind of exercise, how many times a week should somebody do in order to prevent cardiovascular disease?
Actually, exercise gives a great benefit. Whoever is in a high risk for the cardiac ailments or something, their diabetes decreases by exercise, and certain exercise like yoga or something decreases the hypertension also. So the weight, the important factor, the obesity, that is also increases the heart risk and heart risk related factors, and that also decreases. The weight decreasing also bound by the exercise. So exercise generally, we for the cardiac people, we generally prescribe for brisk walking. That is the most important exercise. That is at least 30 minutes brisk walking in the morning or in the evening. That will decreases the weight, decreases the in fact the lipid profile also get better, and the diabetes control will be better. And slow, like light exercise, not with a weightlifting or something. That is also aerobic exercise like things that gives a good benefit for the heart.
Right. So it's important to exercise at least 30 minutes, 5 days a week if possible. That is what the WHO recommends. Again, it's very important, but that you suddenly do not assume or you suddenly do not undertake such kind of strenuous activity, because a lot of us read in the newspapers that somebody goes to a gym, a 25-year-old, and has a sudden cardiac arrest on the treadmill. So before you undertake any kind of strenuous exercise, it is important to consult your cardiologist before you go ahead. So I would like to thank all my panelists. Thank you all for the wonderful inputs. And so we reiterate, and we have one question from the audience.
So, sir, my question to Dr. Hazra, since it's an aspirational nation with so much of youth population, at times this advice of being stress-free or something like that, it looks like an oxymoron. So, what do you rate these advices, and what are the actually in real life, what you need to do? Whether health checkup stands at the top, or whether we should take the help of stress busters?
Beautiful question. I think stress is always there in human life. It could be your working place, it could be your education, it could be your job, it could be your profession, etc. Like if I start as a medical practitioner, we have stressful life all the time because people die, and the relatives, their anger. Sometimes you are not able to show empathy to them. That creates more confusion. So we have to keep ourselves fit by distressing, as Dr. Sumanta has mentioned, and my friends have mentioned. In a working place, if you go for small kind of exercise, yoga in between your lunch or your snacks, or playing certain games, and listening to music, or even singing, as Sumanta has mentioned. So it is very important to distress yourself in whatever manner possible, by yoga, by exercise, happy family, good sleep, and sometimes you do need certain medications to give the relief of your stress and anxieties. So there is no doubt about the fact the whole nation, the young people, they need to distress themselves to live longer, adding quality to their life and life to their years. The sudden cardiac death, as ma'am has mentioned, the sudden cardiac death is happening in this young group of people who are addicted to energy drinking, less exercise, certain kind of vaping, other forms of non-nicotine smoking. It's all important to distress themselves from one kind of stress, but that can lead to another risk factor. So leave all these bad habits, go for traditional way of living if you are really stressful. Thank you.
Sir, one more question to Dr. Sumanta Chatterjee. বাংলায় তো কিছু জিজ্ঞেস করা হলো না। রাত্রে খাওয়া দাওয়ার পরে বুকে চিনচিন ব্যথা, সেই ব্যথা নিয়ে গ্যাস অম্বলের ওষুধ, তারপরের দিন সকাল আপনার কি অ্যাডভাইস? সেই পপুলেশনের ক্ষেত্রে আপনি কি বলবেন?
হ্যাঁ, এটা মানে খুবই ইম্পর্টেন্ট কোয়েশ্চেন। আমরা কম বেশি আমাদের নিজের লাইফে বা নিজের ফ্যামিলির লাইফে বা নিজের কমিউনিটিতে এই জিনিসটা দেখি। এটার মধ্যে আমার মনে হয় যে মেন যেটা সেটা প্রথমে রিস্ক স্ট্র্যাটিফিকেশন করা দরকার। সিম্পল জিনিস, মানে আমরা নিজের যদি আমাদের বাড়িতে কারো হয় যে আমার কি কি রিস্ক ফ্যাক্টরস আছে, প্রথমত বয়স এবং তারপর রিস্ক ফ্যাক্টর, মানে স্মোকিং আছে, অ্যালকোহল আছে, ডায়াবেটিস আছে, থাইরয়েড আছে, ওবেসিটি আছে, হাইপারটেনশন আছে, তাহলে কি কি রিস্ক ফ্যাক্টরস আছে। যত বেশি রিস্ক ফ্যাক্টর তত বেশি এই পেনটা কার্ডিয়াক পেন হওয়ার সম্ভাবনা। কার্ডিয়াক পেন মানে আছে কি নেই সেটা তো আমার পক্ষে বোঝা মুশকিল, কোনো ডাক্তারের কাছে যেতে হবে। তাহলে প্রথম স্ট্র্যাটিফিকেশন হচ্ছে যে চেস্ট পেনটা আমার হচ্ছে, তাহলে আমার কি কি রিস্ক স্ট্র্যাটিফিকেশন আছে, আমার বয়স কত, এই 1 নম্বর। 2 নম্বর হচ্ছে ইফ ইট পারসিস্টস for more than 5 to 10 minutes and it is associated with sweating and this is the first time you are having this chest pain, যদি এই তিনটে ফুলফিল করে আমার মনে হয় টাইম ওয়েস্ট না করে একটা ইসিজি করে নেওয়া দরকার। ইসিজিটা এখন প্রত্যেকটা পাড়াতেই অলমোস্ট হয়, তার জন্য কোনো হসপিটালে যেতে হবে এখনই তাই নয়। ইসিজি করলেই, ইসিজি যারা করছেন কোনো ফিজিশিয়ান হোক বা টেকনিশিয়ান হোক, যদি গ্রস কিছু অ্যাবনর্মালিটিস থাকে তাহলে সঙ্গে সঙ্গে সে বলে দেবে এবং ডেফিনেটলি সঙ্গে সঙ্গে হসপিটালে ইমার্জেন্সিতে গিয়ে আবার ইসিজি করা বা আরো কিছু মেথডস আছে যেখানে আমরা বুঝতে পারি এটা কার্ডিয়াক পেন কি কার্ডিয়াক পেন নয়। তো এইটা মানে বেশিরভাগ ক্ষেত্রে আমাদের যেটা হয় বা ওয়েস্ট বেঙ্গলের বাঙালি পপুলেশনের যে সব গ্যাসের জন্য ব্যথা হচ্ছে, গ্যাসের জন্য চিনচিন করে ব্যথা হচ্ছে বুকে পেটে, সেটা আমার মনে হয় ইগনোর না করাই ভালো। বেশিরভাগ ক্ষেত্রে আমরা এই যে গোল্ডেন আওয়ার থাকে হার্ট অ্যাটাকের, সেটা বেশিরভাগই মিস করে যায় এটার জন্য। কালকে রাত্রে ব্যথা হচ্ছে, আজকে সে ইনি এসেছেন, কেন ব্যথাটা 5-7 মিনিট হওয়ার পর চলে গেছে। তো এই মানে এটা ইগনোর না করাই ভালো। প্রথমে রিস্ক ফ্যাক্টর স্ট্র্যাটিফিকেশন, তারপরে মিনিমাল একটা ইসিজি করে নিয়ে দেখে নেবে।
হাসপাতালে আসতে হবে।
হ্যাঁ, হাসপাতালে আসতে হবে, অ্যাটলিস্ট একটা ইসিজি করতে হবে।
আরেকটা আমার শেষ প্রশ্ন ডক্টর হাজরাকে, সিন্স আপনার সাথে অনেক ইয়াং তরুণ কার্ডিওলজিস্ট রয়েছে, আপনি কোনোদিন নিজের স্বপ্নে দেখলেন যে একজন চেস্ট পেন পেশেন্ট এসেছে, কার্ডিওলজিস্ট বলছে যে হ্যাঁ ঠিক আছে কালকে সকালে অ্যাঞ্জিও, আপনার কি মনে হয়?
না, আমাদের পপুলেশন দেখতে হবে যে যেমন উনি বললেন, ডক্টর দত্ত বলে, ডক্টর মুখার্জি বললেন, এভরি নিউ কনসেপ্ট অফ পেন, সুতরাং আমাদের ভাবতে হবে যে এটা নতুন না পুরাতন। যদি প্রথমবার হয় মানুষের শরীরে এনিথিং, যদি সেটা ঘাম দিয়ে আসে, ধরে নিতে হবে এটা সামথিং আননন এবং সেটাকে ইগনোর না করে তার একটা টেস্ট করা উচিত, কার্ডিয়াক এনজাইম, ইসিজি, অর দেরি না করে কিছু লোকের ক্ষেত্রে যেমন মেল, স্মোকার, হাইপারটেনশন, ডায়াবেটিক, ফ্যামিলি হিস্ট্রি অফ হার্ট ডিজিজ, বাইপাস, স্টেন্ট, তাদের একটা অ্যাঞ্জিওগ্রাম করা উচিত। সিটি অ্যাঞ্জিওগ্রামও করা যায় বা স্ট্রেস টেস্ট করা যায় বা ফিজিক্যাল এক্সামিনেশন করা যায়।
So the moral of the story before we finish is please do not ignore your symptoms. Let the cardiologist or your physician decide. And time is muscle, time is heart. So use your heart, know your heart, and probably that will take us a long way in preventing cardiovascular disease. Thank you very much.
Thank you.